Serratiopeptidase. Serratiopeptidase, also known as serratiopeptidase, Serratiopeptidase, or serratiopeptidase is a proteolytic enzyme protease produced by Enterobacterium. This microorganism was originally isolated in the late 1960s from silkworm Bombyx mori intestine. Indications of serratiopeptidase. Serratiopeptidase is primarily indicated in conditions like hematoma, inflammation, musculoskeletal disorders, edema, osteoarthritis, rheumatoid arthritis, thrombosis, traumatic injury, and can also be given in adjunctive therapy as an alternative drug of choice in bronchial asthma, bronchitis, tuberculosis. Contraindications. Serratiopeptidase is contraindicated in conditions like hypersensitivity, coagulation disorder. Side effects. The symptomatic adverse reactions produced by serratiopeptidase are more or less tolerable, and if they become severe, they can be treated symptomatically. These include nausea, anorexia, gastrointestinal disturbances. Warnings. In patients with blood, coagulation abnormalities, severe hepatic, and renal disturbances or under treatment with anti-coagulants, should be given under careful observation. Serratiopeptidase may occasionally cause gastrointestinal disturbances such as anorexia, gastric discomfort, and nausea. Administration should be discontinued when hypersensitivity symptoms, such as eruption, appear. Adult dose of serratiopeptidase.